represent actually RBF retirement. We do all things retirement. This particular presentation is all about Medicare, and there will not be anyone trying to sell you anything. We're just going to be educational, completely educational, and reviewing everything about Medicare so that afterwards we can meet one-on-one if you'd like to be able to go over your ins and outs of your personal situation. So we are going to be discussing your supplements, advantage plans, drug plans, that type of thing, just kind of briefly, so that we would, when we meet at another time, we'll be able to go into specifics. So this is based off of 2023. At the end of the year, the new drug plans and new deductibles, all that kind of stuff come out. So as of right now, these are all based on 2023 prices. Medicare Part A is what you get when you have worked 40 quarters or 10 years out of your working life. So when you've paid into your FICA taxes, Medicare Part A is covered on that. So you get it for free. There is no premium. There's only a premium if you have worked in a position or a career that did not take out FICA taxes, or that if somebody was a stay-at-home mom and never worked, they would have to have a premium that goes along with that. But for the majority of people, there is no premium. We call this the bed and breakfast of Medicare. It is the hospital and the food only. That's all there is. It also comes with a deductible of $1,600 per incident and per time, covering the first 60 days in the hospital. So meaning that $1,600 can be charged up to 6 times per year because it covers 60 days in the hospital. For instance, if you were to go in the hospital and you broke your leg January 15th, and you are in there for several days, you will be charged the $1,600 deductible, but your time in the hospital would be covered because it's the first 60 days. You leave the hospital and you have a heart condition in June because it's a different type of incident and it's after those 60 days, you will be charged another $1,600. So everything that you are seeing on your screen that's highlighted in yellow is actually out-of-pocket expenses for Medicare. We have a way that we are able to help you pay for those, which is called the supplement, and we'll get into that in just a little bit. But just for your benefit, the highlights in yellow are what would be out of pocket. When Medicare first started, it was never intended that you would have completely all your Medicare paid or your health paid for. It would be that you would contribute as well, the government would contribute, and then you would do something in between, which is when the supplements came into play. To go back on this, once you get past day 60 in the hospital, if you were an extended stay, 61 to 90 is $400 per day. And even past that, 91 to 150 is $800 per day. So that, as you can look at it, could be a big, huge chunk of your retirement savings coming out of pocket if you did not have another way to pay for these expenses. People never think that they really, oh, who's going to stay in the hospital that long? But looking back at COVID a couple of years ago, there were people staying in for extended amounts of time. And we had a client that actually fell off scaffolding. They fell, they broke several bones and had internal injuries. He was in the hospital for about 75 days. So just taking that into consideration, he would have had a $1,600 deductible and he would be paying $400 a day from day 61 until about 75 when he got released. That was a big chunk. And then he had to actually go into rehab afterwards. So those are just big expenses that go along with Medicare. But again, we have a way that we can help curb that. The next part of Medicare, Part A, is hospice. You have up to 6 months of hospice care included in Part A. If you were, some people get better in hospice. They really is not end of life all the time. You can go back and they can approve for another 6 months for extended hospice care. Any questions so far? Does that all make sense?
Yep. That's good.
Okay.
Mm-hmm.
The next section past that is called skilled nursing. Most people consider that to be rehab, but Medicare's term is skilled nursing. So with that, the first 20 days or 20 visits, so whether or not you have somebody coming to your house or you're going into a rehab facility, either 20 visits or 20 days is covered under Part A Medicare. Anything past that, 21 to 100 is $200 per visit or per day. Anything beyond that would be considered long-term care. So once you've gone past 100 times, you could be put into long-term care. And nothing in Medicare covers long-term care. About 70% of all Americans will need long-term care at some point in their retirement and before they pass along, but it is not covered. So that's a topic for another time. And we have ways to help with that as well. But again, it's not something we need to discuss at this point in this presentation, but it's something that needs to have a discussion about. Anything on that? You understand pretty much everything about Part A? Again, it's the hospital and the food, nothing to do with doctors, nothing to do with anything else but those two parts. And that's what you paid into for your FICA taxes all your years working. Good?
Yes.
Okay. So moving on past that is Medicare Part B. Part B is everything else, not prescriptions, but everything else that is around your health. It's your doctors inside the hospital, outside of the hospital. It's x-rays, ambulance rides, it's chemo, any specialty doctors that you're going to, any labs, anything like that is all under Part B. And there is a premium that goes along with that. And it's called IRMA. It's an income related monthly fee. And it goes, you get charged based on a 2-year look back into your taxes. So the one that we have here highlighted in red is $164.90, and that's the basis, and everybody has to pay that unless they make a higher income. So for 2023, it's $97,000 if you are single, or if you're married filing jointly, it's $194,000. And again, that's a 2-year look back. So for 2023, they're looking at 2021 taxes. So the next year, it would be the next tax year. So for 2024, they'd be looking at 2022. If there's ever a chance that your income goes up because of a special incident, you sell property, anything like that, that affects your taxes, and it's only a one-time thing. A lot of times we can go back and get, and it's not going to be something recurring that's going to stay with your income. We can go back and appeal it, but that's something for a discussion privately as well. With this, there is a deductible, but it's only one time. It is not repetitive like Part A. And 2023 deductible is $226. That's highlighted in red because it's something that even a supplement cannot cover, but it's just an annual deductible one time a year. The other parts about Part B, so you understand that this is an 80-20 split. This is somewhat similar to what you're used to in a commercial insurance setting, where you go to the hospital or your doctor's office and you have a bill that comes out. They would pay for 80%, you would pay for 20%. And just like where you have the commercial insurance, where they have codings, the doctor offices has to actually code for a procedure that you get done. Medicare does the same thing, and that's actually called Medicare assignment. And we have an example on the page here that says, an example, $100,000 surgery. That could easily come out if you have a heart condition or something else happen in the hospital, your bill is $100,000. Assignment typically can pay around 50%. So in this example, we have $50,000 paid. That means Medicare has approved that amount. If that were so, they would pay 80%, which is $40,000. You would pay 20%, which would be $10,000. Again, that's a out of pocket for you to pay if you were on original Medicare and did not have a supplement. So that's highlighted in yellow. Again, another way that we can help make that cost go away, but it would be your responsibility if you did not have a supplement. The part of this that is next on here is something called excess charges. So there are some specialty doctors that do not take Medicare assignment, and typically we call them the ologist. So it's anesthesiologist, sometimes oncologist. And usually this could occur if there's an emergency situation, because if you have a scheduled surgery, most people would go ahead and confirm and make sure that the doctors that were going to be involved with the surgery would be taking Medicare assignment. So in an emergency situation, you really want your life saved. You don't have time to go back and confirm whether or not they will take assignment. So if they did not, and you got a bill, it's called excess charges. So in this one, if the excess charge, all you can do is charge 15% of the bill. So the difference in that $50,000 difference is $7,500, but that's not typical. Not that a specialty doctor would not charge you $50,000. Not to say that it couldn't happen, but in another instance, say you got $1,000 bill, the most they could charge you of that is 15% is $150. So that's more like it. So the way that we are able to cover all of those yellow highlights for Part A and Part B would be through a supplement. And that supplement would cover every single out-of-pocket that you would have, the deductibles on Part A, the extra per day fees, when you go into skilled nursing, if you have additional time for that, it would cover that. It would also cover the 20% on Part B. And for certain supplement plans, it will also cover the excess charges. That supplement plan can also include foreign travel. So you can go to any doctor anywhere in the United States, anytime you want. There is no referrals. You go, you choose your doctor, you choose where you want to go. So you're choosing how your health is being taken care of. If you do travel out of the United States, they have $50,000 for a lifetime that they will reimburse you back for. So that's another big benefit if during retirement that you want to travel to overseas. So there's a couple different ones that we recommend of the supplements. There's one that's a supplement G and a supplement N. For the G plan, it would cover every single out-of-pocket expenses. Again, not long-term care, but everything else except for your Part B deductible, which again is highlighted in red on this page. It's currently $226. So when you pay for a supplement, that's the only out-of-pocket expense you'd need to pay each year is $226. Everything else would be covered. If you would get one other supplement, it's the N plan. It's typically about $50 less. So sometimes that amount per month in a premium is very helpful to clients. It covers everything, again, the same as the G plan. It just does not cover excess charges. And there are co-payments up to $20 per visit when you go to a doctor or specialty. And if you go to the emergency room, it's $50 unless you get admitted. And if you do get admitted, then they waive that fee. But those amounts, you can see if the 20%, just one doctor visit or one surgery that you had a 20% was $10,000. Hospital, $1,600. If you're going to skilled nursing, the $200 per visit, all of those are big, huge expenses. And having a supplement that starts at for $123 and goes up to for females, it can go up to over $200 if you get a G plan for a male. So we'd have to look at each instance and when you're turning on your birth month and what year it's in, and we'll be able to determine how much that premium payment would be for which plan. But it will cover all of those. So you can kind of see it's usually about $2,000 or $2,500 a year that you would pay to never have anything come out of pocket except for that Part B deductible, which, as you can see, there's lots and lots of money that could be spent in your healthcare just in those deductibles. So it's a great alternative to make sure you don't have any issues arising when you get older and you have something drastic happen, cancer, Parkinson's, anything like that. When you are getting into Medicare, when you turn 65, it's the one time that you have no healthcare questions. We like to say that you literally could be smoking a cigarette on oxygen and having cancer, and Medicare cannot turn you down. Now, when you get a supplement, if you do use tobacco, there is a premium difference in what that supplement would charge, but otherwise, no healthcare questions. You cannot be turned down if you're in your initial enrollment stage. So best healthcare you could ever get, in my opinion. Any question on this?
I do have a question.
Okay.
does it go up, that supplement? Like, say it says 123,
Mhm.
the older you get, does that
So
price?
it's not based on age. So it depends on if you're getting an N plan or a G plan. So your premium starts where we would look and see where you are and which supplement you want. So it's going to be, you would choose what company you want to go with at that premium. So not always, but there are chances every single year that it could have a price increase. It's not going to increase because you have turned a different age, but
Okay.
just that they would be having price increases. Some of them have zero, they do not do it at all. And some of them typically be 4 or 5%. So yes, the price can go up and does, but
not by age.
we don't have a crystal ball, and wish we did, to be able to say which plans would go up, which ones won't go up. But so yes, there could be price increases, but not based on your age. So like every year you turn a year older does not mean that you will have a price increase.
Okay.
Does that answer the question?
Yeah, thanks.
Okay, so going to the next two parts, Medicare Part C is actually an alternative to Medicare. It's called the Advantage plans. It's what everybody sees all over the TVs, typically between October and December during open enrollment. But actually now if you turn on TV, I see it a lot more often too. It's like all over with all this little fine print down at the bottom that you don't ever get to read. And so it's a lot of times it's misleading in some of the information if you don't have all the correct information about what it covers and what it doesn't cover. It's a great plan and a great alternative for a lot of people, but you just need to know the specifics about each plan. So what this is you still have to pay your Part B premium, for this instance, $164.90. And it's a network. It's pretty much like the commercial insurance most people have had during their work life. So it's an 80-20 split. You have networks of doctors. You have to do referrals to specialists. You have networks of hospitals. It's based on a zip code. So if you leave that zip code, good chance you may have to change a plan. It's a very limited network, depending on if you're going to an HMO or if you're picking a PPO. And there are out-of-pocket co-payments, deductibles, and maximum out-of-pocket expenses, some of which can go up to past $10,000 a year, depending on what plan you select. For instance, we're in Sarasota County and Manatee County areas. If you live in Sarasota, Sarasota Memorial is one of the biggest hospitals, and Cigna and Humana are not taken at Sarasota Memorial. So if you're looking at an Advantage plan, and one of those should not really be something you look at, or just make sure you have an agent that's able to make sure that they understand the scope of the region you live in, to make sure that they are covered on the hospitals that are available to you. There's additional benefits that come along with Advantage plans. You can get money back on over-the-counter medications. You can get dental, you can get vision, and some of them have health or hearing. That's things that are not covered through original Medicare or with the supplement, but they are additional benefits that you can get on this. So, and there's many plans that you can choose from. Some that are geared specifically towards veterans, that they can give backs of premiums towards the Part B. So this is definitely an option for a lot of different groups of people. It just takes a lot of time to make sure all of your doctors are put in, all of your prescriptions are put in, so that your agent knows everything about what you expect, and we can pick the right plan for you. Because if you pick a wrong plan and your prescriptions are a lot more money on this plan than on another one, or if you pick the wrong pharmacy to go to, that type of things. There's a lot of ins and outs of Advantage plans to make sure you pick the right plan. So again, with that, if you don't work with me, work with somebody that's knowledgeable in this area to make sure that you pick the right plan for you. Any question on Advantage plans?
No.
That kind of wraps it up. Okay. So if you go, Part D is the only letter of Medicare that makes sense to people, because it means drugs. So going back to Part D, that's if you were to stay in original Medicare, which is Part A, the hospital and the food. Part B, all of the doctors and that type of thing. And then you would have a Part D as well. It's the drug plans. Now, kind of going back, on Part C for the Medicare Advantage plans, most of them have, or some of them have a prescription drug plan included in them. So you can also pick prescription drug plans on Medicare Advantage plans. So they have their own version of an A, B, and drug plan on a Medicare Advantage plan. But if you're staying in Medicare, original Medicare, you need a Part D. And there's 23 different drug plans that are available, and they change per year. So usually October to December, they'll be releasing the new ones out, and we will know what the prices are for them. They usually go up from a little over $8 to over $100 per month. There's a lot to choose from. And they go between 5 and 6 tiers of drugs. So the drug manufacturers put them, they have a formulary that they make for those drugs. And then the plans pick those drugs and they put them into different tiers. And those tiers all have a cost associated with them. So when we put in your prescription drugs, then we would be able to pick a plan that's right for you. And you can only change that once a year. So an initial enrollment, when you're first turning 65, we will work with you, find a drug plan that fits what your prescriptions are. And then each year we will review them with you to make sure you're staying on the correct plan. Because a lot of times as you get older, your prescriptions are going to change. You're going to have your health decline, and there's going to be different drugs that may come up, and we need to make sure that you are for the following year in the right plan for you. We just had a client yesterday that I met with that we looked at different drug plans, and one of them was $8, and he'd be spending a total of about $400 per year, including his drugs. You go to a different drug plan and it would have been $100 premium per month instead of $8. He'd be spending $900. Nothing different other than the drug plan that he was put in. So if you don't have somebody that is knowledgeable in this area, again, you don't know what you don't know. So if you have somebody that knows that we're able to help you in this area, it can help save retirees a lot of money and making sure that we can help you. And even if you're on something for some health issue that you have that has a drug that's very expensive, we have other ways that we can try to help. The last part pretty much is that this is an overview of just what we've gone over, but there is a timeline for what things need to be done in a certain time period. So in Florida, we are able to write supplements 6 months prior to your birthday. So there's 10,000 people turning 65 a day. So they open that up earlier so that we're actually able to write those supplements earlier. But opening from 3 months prior to your birth month is when you would apply for Part A and B. And then about 30 to 45 days or so is when we try to get people enrolled in Part D, the drug plan, if you're going to go into original Medicare, just to make sure that any kind of drugs that you happen to be on, prescriptions, that we know that it's up to date. And then you can actually, so your open enrollment is 3 months prior, your birth month, and 3 months after. So that's your open enrollment period. But we like to start things earlier because it takes several weeks for you to get your red, white, and blue cards, your Medicare number. We need that to be able to get your drug plan. So there's a certain timeline to make sure that you follow. And also all this kind of changes if you're staying working. If you're turning 65 and you're going to continue working and you have credible insurance coverage, then you can do that. But we have to make sure things are done in a proper time so that you don't get penalties for Part B or Part D that you didn't choose at the right time. So this also kind of maybe sounds very confusing because there's a lot that goes into Medicare, but this is just a brief overview so that you can understand what each letter is. That's part is most people can't understand what's B and what's C. But this just kind of wraps it up very general. And then if you have an interest and you need to go further, we can discuss your personal situation, your prescriptions, anything like that, so that we can help you make a decision on whether or not Advantage plan or a supplement is the right route for you.